Absolutely. So I've been a pharmacist for the past 17 years. And the best parts of my day are when I'm listening to my patients and I'm helping them understand the science behind the medications and supporting them live healthier, happier lives. Any time that I spent on manual, repetitive tasks, I felt at a loss. And there's a lot of them because pharmacy as an industry needs modernization. The infrastructure is based on a 200-year-old legacy system of paper prescriptions. That's why I set up...
With the famous doctor's scrawly handwriting that only you can read.
Absolutely. It properly needs decoding, actually.
Yeah.
So I set up PillSorted as a new model of pharmacy, ones that care first but fully enabled by technology. We deliver people's medication because that's what they want. We deliver their repeats on time, making sure they never run out of the medicine. We deliver the acutes on demand as well. And we upgrade the care. They can counsel their pharmacists, other healthcare professionals from the privacy and comfort of their own homes.
So let me ask how it works. I go to the doctor if I can get an appointment.
Yeah.
Can't tell you how many emails I've had from people who can't get a doctor's appointment these days. Or I'm able to renew a prescription, an existing prescription, with a phone consultation, which is also possible, of course. I then get that prescription. What happens? I don't get something in my hand with a scrawled piece of writing on it, and I don't then have to go to my high street in order to queue up at a pharmacist to get the drugs dispensed to me. That's where the word comes from, right? Dispensing chemist. How does your model work, and is it available on the NHS?
Absolutely. So that's the beauty of NHS. NHS has connected all the GP surgeries and all the pharmacies via an electronic system, an electronic database. So you as a patient can ask your GP surgery or ask us, the pharmacists, and say, I want you to be my NHS pharmacy.
Okay.
In that way, we link it to the NHS database and say, I am this patient's NHS pharmacist. When you go to the doctors, they will write you a prescription, but the prescription is electronic.
And you get copied in, as it were.
Exactly.
And then that is your instruction from the doctor, because it's a secure email.
Absolutely.
And then you post, or do you deliver by courier? Do you use the raw mail? How does that work?
Very good point. We use our own fleet of regulated, reliable drivers because
it's a bit dangerous to send drugs through the post, of course, isn't it? And in some cases, I think it's actually against the rules, certain kinds of drugs.
Rules have changed quite a lot. If I give you a spectrum of what's out there right now, on one side we've got 14,000 community pharmacies, which provide the face-to-face personalized service. On the other side, we've got the online pharmacies that deliver usually via postal service, actually. And there has been a lot of hit and misses of what they can deliver and what not.
Right.
PillSorted combines that personalized feeling and it keeps it consistent with the technology that we have.
Yeah.
And we deliver by hand delivery. So that fleet of drivers that go to the patient's home can bring trust that there's a pharmacy behind it.
Okay.
So, and it's all integrated, yeah.
So do you still have a physical location for the pharmacies under your model?
Of course.
So people can still, if they want to, because for a lot of people, particularly during the pandemic, you guys were the front line, right? And I know some of my friends are pharmacists. Yeah, they were working really hard because they felt the GPs weren't always there. Apologies to many, many NHS GPs who did work very, very hard. I'm talking not in general. I'm talking about emails I've had from many, many viewers and listeners about the lack of GP face-to-face consultations. Yeah. Because for a lot of people, the high street pharmacist is still valuable as a reassuring presence, a symbol of trust and a symbol of advice. And under your model, you're not going to remove GPs from the high street, are you?
No, that's...
pharmacists, excuse me, from the high street.
That's a brilliant point you said. There will absolutely always be a need for a walk-in centre, for people to have access to a healthcare professional without having to make an appointment. And I've been a community pharmacist for the past 13 years, and kudos to all my, colleagues. They've done a fantastic job, especially during COVID. As you said, we've been there, we've been, passionately trying our best for the patients. So that is a need. And I credit to NHS, especially in the long-term plan. They have acknowledged this fantastic service that the pharmacies are creating, and they are, changing the models to make sure there are enough services and pharmacies are getting compensated for it. In the short term, I'm focusing on the patients that actually need that delivery service and they need their medication.
Because they're elderly or frail and they can't always get to the pharmacy, okay.
Yeah, or any other person. So a young mother whose wake-up times is different from the pharmacy shop time.
Yeah, of course.
They need that help as well. Plus upgrading and making sure that they never run out of their medications. So we make sure that they can have that conversation with the healthcare professional, but from the privacy and comfort of their own homes.
So if people want to use your service, what do they do? Do they ask their GP? Are there other providers like you who are trying to link together the NHS dispensing model? And how do you actually make money from this? Because you're providing an extra service.
Exactly.
Does the NHS pay you more to do these deliveries?
Excellent question. We do not cost NHS any extra than any other pharmacy. We do not get paid extra for the delivery at all. In fact, my whole aim is to save NHS money by preventing the costly hospitalizations. Why? If a patient misses their medication, this can have dire consequences on their health, and this can lead to A&E trips, it can lead to hospitalization. When there's a pharmacist that proactively takes care of their medication, helps them, supports them with the medicine management, they are more likely to have a settled condition, feel safe and feel confident, stay independent. And this saves NHS a lot of money. So we work a lot to personalize the patient's journey. Example, I started making...
carry on.
I started making a list for any patient with their medicine, with the tablet, the shape of the tablets,
and
when to take it.
Yeah.
People absolutely love it.
Yeah.
Now I've used the technology to actually implement it, and it comes automatic from the dispensing data. And it's been a great value for a lot of patients.
Well, Zeinab Ardeshir, you are the CEO and co-founder of PillSorted.
Yes.
It's really great to hear about some innovation going on in the NHS at the sharp end, helping to put customers first. And we wish you all the very best. Great to have you here in the studio with us. Zeinab Ardeshir there, the CEO and co-founder of PillSorted.